morning, and thank you to Thomas Getz and Wired for allowing InTouch Health to be here today and to share with you our Dr. Roboto, as it's said in the program. And so I will be co-presenting today with Yulin Wang, who is our CEO. I'm going to start off and spend just a few minutes taking you through the commercial journey that we've been on at InTouch Health, and then Yulin Wang here to my right via robot will be virtually joining us for a portion of our segment and really sharing a little bit more about, indeed, his vision for remote presence and where we've come as a company and as a technology. So with that, here we go. So really, there's a real legacy of innovation at InTouch Health, spanning really back to before we were founded. The founders of InTouch had previously founded a surgical robotics company and had embarked on really developing and pioneering surgical robotics. And from there, we have since moved on to taking robotics in a different direction in healthcare. And really with the pursuit of how can we use robotics to really enable physicians to be virtually present, really be able to provide their expertise and consultations when they can't be physically there in a hospital setting. And there's really two drivers that have enabled InTouch to commercialize this technology and bring it forward to where it is today. One, really a convergence of different enabling technologies. Technologies such as remote therapies, technologies such as the iPhone and the iPad and ubiquitous communication devices, medical informatics, and then really how that all plays together into an embodiment of a true remote presence with what we've developed into our flagship product, our RP7 robot, which is shown there at the bottom of the slide. So the second driver that really has enabled the successful commercialization of a robot that can be very enabling in a healthcare environment is really the notion of the ubiquity of bandwidth that's occurred really over the last number of years, as well as really the cost of bandwidth going down. And it's fair to say that our technology, if you go back 10 or 15 years, would really have been a very nice project, but really we believe would not have been commercializable as it is today. And so it's really the convergence of these two things which has enabled us to get to where we are. And really it's enabled us to get to the real promise of telemedicine and remote presence, which is a reliable communication device that enables a physician to be really in two places at one time. So I want to share just a little example here.
Health Center is one of many small community hospitals who are partners in Barnes-Jewish Hospital and Washington University Medical School's Acute Stroke Network.
We're one of the largest hospitals from Festus to Cape Girardeau, Missouri. So we serve many very rural counties. We have 100 beds. We take care of any emergency that comes to our door, of course. However, sometimes you need that specialist.
And when that specialist is needed, doctors here used to reach for the phone to contact Barnes-Jewish Hospital. But now a new tool is helping them bring that expertise right to a patient's bedside.
Put that down and
it's a robot that includes a camera, microphone, and television screen to provide instant video conferencing.
Will make a huge difference, I believe, in the quality of life for patients.
What it really does is kind of expands our ability to provide care to centers remotely. So this is using telemedicine technology, which is a two-way video between the patient bedside and the practitioner.
It's one of the latest ways technology is bringing the expertise of Barnes-Jewish Hospital and Washington University physicians to patients outside the immediate St. Louis area.
it is one of the unique things here that we have neurology, neurosurgery, interventional neuroradiology, all kind of under one roof, with all with expertise and all available 24 hours a day, 7 days a week.
It will allow us to bring more expert care to the bedside in a more timely manner. And obviously with stroke patients, time is of the essence.
Doctors say when it comes to stroke patients, time is brain. Important clot-busting medicines that can...
So we've really come to a new place now with remote presence when we're trying to help solve two fairly significant unmet needs in the healthcare system. One, around telestroke, the ability to get a stroke specialist to the bedside very quickly, and secondly around tele-ICU management. And there are some staggering statistics here around stroke and just the prevalence of stroke in our country, and also around tele-ICU, that have really driven the use of our technology in these high acuity clinical use cases. And so today, 10 years on from our founding in 2002, we've gotten to a point where we're now deployed in over 650 hospitals across the world, mostly in the US. We've got about 70 telemedicine networks that have been created using our technology, using our robot, placed out into outlying hospitals, enabling specialists to, again, provide their care and expertise via the robot to hospitals and patients in need. And now we're actually close to 6,000 clinical consults are being done a month on our robots, and indeed, we're saving lives every day, or helping to save lives every day through the use of this technology. So what are some of the challenges? Because we've gotten this far over the last 10 years, but certainly there's more room to go. And this is the triple aim in healthcare, which is really how do you deliver better care, high quality care at a lower cost. This is something that politicians and administrators and everyone is really focused on doing, and it's not easy to do. And there certainly are still many structural barriers and difficulties to achieve the triple aim in healthcare. There are also technology and adoption barriers, and I shared this slide, and this is actually, you may recognize Thomas Getz up there, interviewing Vinod Khosla back in August. And Vinod had a fairly provocative statement talking about healthcare being like witchcraft and based on tradition, and the fact that healthcare really must be more data-centric or data-driven, with wellness as really a key driver, and that 80% of healthcare going forward might be, or doctors might be replaceable by machines. Now, InTouch has quite a different view than Mr. Khosla on that. And while we certainly believe in big data and the ability to have data support the diagnosis and treatment of patients, we think there's a lot more to it. And so we've got a vision at InTouch for where healthcare can go as enabled by data, where physicians are not necessarily going to be replaced by data, but data can be very complementary to their ability to deliver care, high quality care at a lower cost. So what have we found as some of the barriers at InTouch? Because certainly there are adoption barriers to use. And as you saw the RP7 robot up there at Barnes-Jewish Hospital, one of the things that we found is of every 10 doctors that are using our system, our robot, actually about 4 of them really love it. They love using a joystick and driving it around, and they actually are into that. Another 3 or 4 are sort of indifferent to the experience. And then 2 or 3 say, I will never touch that. I'd like the nurse to push me to the side of the bed, and then I'll deliver the care that way. So we've had to address those barriers, certainly, as we've started thinking about new enabling technologies. And we're about to share with you RP Vita here, and Yulin Wong is going to share a little bit more about it. But really, what it comes down to is this question, which is, what is the future of healthcare? And does anybody know what this represents on the screen? Who knows what that is? Prometheus. It's the health pod from Prometheus, right? So and a rather grotesque scene where a cesarean section is being delivered through an autonomous robot. That's certainly not what we believe the future of healthcare is. While it's an interesting and provocative scene, Yulin, I think, is going to share with you a little bit more about the vision of where we see RP Vita. And this is really the grand unveiling of RP Vita on the world stage to Wired and the Wired Health Conference. We did unveil this platform back in July at a smaller users group in Santa Barbara. But I'll let Yulin share a little bit more about the vision going from here.
Great, thank you, Charlie. And it's a pleasure to be with you today. And thank you for allowing me to be here remotely present. I have my company board meeting starting in a couple of hours here, which is why I wasn't able to make it there in person, although I saw the program. It looks very, very exciting. When you have investors and you have board meetings, you got to be there. Back to kind of Charlie's comments, and starting with the 20,000-foot picture again for a second. You know, the challenges we have in healthcare are quite significant, and they're based on these trend lines, which are really just, they're just inevitable. We have an aging population. We have a growing population. We have the same number of people going into healthcare that have been doing so in decades, and we have a continued subspecialization of medicine, which is actually making it very, very difficult for us to be able to provide high-quality care. So, there's a bandwidth gap.
Everybody's online. This is wired, Yulin. So I'll take over, and I think really what Yulin's speaking to as we get more bandwidth. I said bandwidth was increasing. I guess it's really we're talking about how do we narrow that gap, and where InTouch has come with, call it remote presence 1.0, is really the enabling of access through technology and bandwidth. Where we want to go with healthcare 2.0 is really how can devices like RP Vita here really enable a coordination of care, true coordination of care, which is a combination of course, technology, but also people and process. And really that's the key, is how do we bring together technologies that can be enabling, that can really be used and embraced by physicians and caregivers, and have those technologies be tools. And so what Yulin was going to explain is really that RP Vita has come to a new place with the way that it was created in concert with our partner iRobot to really be an autonomous robot. This robot actually can map its environment, so map a hospital environment, and actually, as opposed to having a physician have to drive the robot with a joystick, which is our previous technology, a doctor can now point on a screen, literally on an iPad, and tell the robot to go from point A to point B, and it will proceed that way without having to be driven. Yulin's back, so I've tried my best to fill in for you.
All right, so this is the challenge of a demo in a hotel where you are on the guest network. And I was literally connected for half an hour ahead of time, and I did not have any drop-offs, so we thought that the guest network was fine. And then someone probably downloaded a whole series of YouTubes right as I started talking, and that's what happened. So, I mean, the one thing which we can't, we require is bandwidth. So back to what I was saying, the issue is with all of the trend lines going, how do you get the high-quality care to the right place at the right time to do the right thing? And the bottom line is, if you can do that, you can actually reduce costs and provide high-quality care at the same time, which is actually what everybody's looking for solutions to. So this is why we developed this remote presence concept. What's happening right now? I'm actually in my office in Santa Barbara, California, and I'm logged into you, and I'm actually going over the public internet. When we started this 10 years ago, we didn't know whether or not the public internet was going to have sufficient bandwidth, low enough latency, high enough quality in order to support this kind of application. Before this, it was these ISDN lines, which are point-to-point, and they were very, very costly as well. But with the proliferation of the internet, now this kind of connection is possible. So I'm coming up, I've got a broadband line up to the public internet. I've got my cloud service, which is constantly monitoring the best way to make this connection possible, and then I'm dropping down into where you're at. And then what's always the soda straw, if you will, is the last half mile. And so so that's where we're on the guest network of the hotel there, which has as many users as is as go on to it at any given time. Now, in a hospital environment, we would actually secure a certain amount of bandwidth off their pipe such that there always is sufficient bandwidth to do this. So a little bit about RP Vita and this remote presence. The idea is that we want to enable the clinician to be able to be present somewhere else, from anywhere to anywhere, and operate and work as if they were standing there in person. And so that's the objective. It's a little bit like, you know, the movie Avatar, but obviously for clinical applications, where the physician is as enabled as possible to move and interact in the environment as if they were there. Charlie mentioned that previous to this RP Vita, we've had a system called RP7. I think he showed a quick video of it, which actually uses a joystick in order for the clinician to move around. And we've had good adoption, as Charlie mentioned. We're in over 600 hospitals, but it captures the visionary's mindset. But as we're making progress in terms of market adoption, we needed to really drive ease of use. And so this is what RP Vita is all about. We actually partnered with iRobot in order to build the platform you see in front of you today. And what RP Vita has in it, which is quite unique, it's the first time it's happened in the world, is it has environmental awareness. Because of a combination of a very sophisticated sensor suite and software, Vita knows its surrounding. And because of that, it can actually automatically move around amongst people throughout a hospital in order to get from one place to another and do things. So now, what this environmental awareness will allow us to do is, first, it will allow us to get the ease of use even easier. It's a little bit, the analogy I like to use is, as we transition from MP3 players to the iPod, everybody got onto the digital music bandwagon because it was so easy to use. The objective here is that the clinician, just holding an iPad, taps on the iPad where they want it to go, and it goes there. And I can't show that to you here because I'm on the other side, but that is actually what we're capable of doing now. So that's the ease of use. The next step is actually, Charlie showed a video which was actually bringing expertise from a large center to a smaller center out in a rural location. And this is where telemedicine has started. Telemedicine has started by providing higher level expertise from a larger center to a smaller center, and this is where applications like stroke, like ICU, et cetera, make sense. But I think that this concept of telemedicine and remote presence has much further to go. Where we can go, and in fact, if you can move to the next, okay, you're on the right slide already. So this concept of enabling access is where the field is at, but I think it's very possible to take us another step forward to where we're coordinating care. In the year 2000, the IHI published a report to Err is Human. It showed that the 8th leading cause of death is actually medical error. 100,000 lives a year are lost because of medical error, and it's really all about the coordination of care. As patients, as staffs from the day shift hand off to the night shift, as patients move from the outpatient center to the inpatient center, as patients are transported from one location to another, the care across that continuum is not well documented and the flow-through is inexact. And so we think that by the uses of telemedicine and platforms like this, the RP Vita, we can actually drive to the next level of telemedicine to where we're not only enabling access to where care is needed, but also we're able to retune how care is delivered so that it is more coordinated, it is and resulting in higher quality and lower cost. So those are the main points I wanted to make, Charlie. And so maybe I can turn it back to you. And I'd like to thank you all again for the opportunity to be here. And I'm going to go to my board meeting.
Thanks, Yulin.
All right, thanks. Okay, bye.
So in wrapping up here, we're going to share just a little video vignette to spark a little bit of some concepts and ideas on where the future can be through RP Vita. But I did want to just reiterate what Thomas Getz said yesterday about using this forum to really spark ideas and thoughts. We hope we provoked some thoughts and ideas around the use of telemedicine technology. I would love to hear some thoughts that you all have individually out in the hallway as you start thinking about applying this to practice in your various industries. But this has been very much an exciting journey for InTouch to get to this point. And with that, we're going to share a video, and we'll move on to the next presentation. Thank you.
At precisely 7:25 a.m., a routine yet remarkable event transpires at Metro Hospital as RP Vita, a revolutionary remote presence robot, automatically undocks, capable of being sent to any location by simply touching a screen. This morning it travels independently to the critical care unit, where it will access clinical data and choreograph care by a multidisciplinary team. Each year, nearly 100,000 lives are lost in U.S. hospitals, most of which are due to lack of and errors in communication. Metro Hospital is helping eliminate preventable deaths by focusing on patients and using RP Vita to coordinate the delivery of multidisciplinary team-based care. Today, RP Vita starts by alerting the first patient care team members, which include a nurse, respiratory therapist, and case manager who attend in person, while a critical care doctor, surgeon, and pharmacist join in remotely. Upon arriving, RP Vita displays patient data for the remote team members, and a radiologist is invited to participate by tapping its touch screen. The consultation concludes by detailing daily patient goals, and the nurse accompanies RP Vita to the next patient, where the process is repeated. Once rounds are completed, RP Vita automatically returns to its charging station and docks, ready for the next coordinated team care rounds, or to perform any of a growing number of clinical uses that are making remote presence routine.